So if a denture wearer goes into your practice, what are their options when it comes to implants?
One of the things we've seen is that a lot of patients know about 2 implants to hold in the lower denture. And Randy, that's not satisfactory. Most of the time we see patients who have that, and that denture still moves around too much for them to be comfortable.
Okay.
So the first option we look at is putting 4 implants in the lower and snapping that lower denture in.
What could they eat with that?
You can eat things like chicken or a salad.
Okay.
These things start happening. But the really cool thing is when you have that confidence with that lower denture and it doesn't move, you start thinking, what can he do for the upper?
Okay.
And that's where a lot of magic happens. We can put 4 implants in the upper for another Snap-on Smile, but you take that big suction cup of a denture and you make it U-shaped. Open up the palate where a lot of taste buds are. So that morning cup of coffee, first thing, tastes much, much better.
Nice. How old can you be to get this done?
I've done this on patients well over 90. 93 years old, I think, was my oldest patient.
Is that right?
Yes, sir.
And how soon, once it's done, if everything works out right, how soon can they eat?
The next day.
Really? And
Yeah.
do they?
Oh, yes, they do. Yes, they do. A lot of people want to know, gosh, that must really hurt. It's surprisingly little pain. It's very little pain. I did this for my mom.
Okay.
And she said, Doug, I took 1 pain pill at night, went to bed, and the next morning I felt great. I did this for my dental assistant, Randy, and she woke up the next morning, forgot she'd had it done, and went to had breakfast.
Okay.
It's unbelievable.
So now, what about people that, the other option, no teeth that just don't come out, upper and
Okay.
lower?
And that seems to be where we take patients. A lot of times patients will come in and say, boy, I had no idea how good I feel with the Snap-on Smile. But can't you put them in permanently? Indeed, we can do that. We can do that. So they stay in, they're like your regular teeth. You come in every 6 months, we check you, clean them, but guess what? You don't get a cavity in titanium implants. So you don't, all those frustrations you had over the years with the root canals and the extractions and the emergency patients and the swelling, it all goes away.